get it this time. $98.43. $144.83. That's high for me still.
And where is your pain located today?
Probably everywhere. But it's mostly in my back. It's right now it's most, you know, I've been coming in here since I fell last year, saying what's wrong, asking, you know, saying what's this, and I remember even one time I had told you that one girl I don't want to see, that one PA that was right, because she basically said that I would have knee pain. It's just going to be the rest of my life, and I said I don't want to deal with negative Nelly, a PA that's a negative Nelly.
Yeah.
And then Chris came, and Chris tried to do. I'm sorry, Carrie. Chris was the other place. Yeah. Carrie came, and Carrie tried to do everything she could, because I kept saying that pain. And, you know, when I went to physical therapy both times, I said, why am I not able to run and walk and do all the things I did before? If it was just a fall, and if nothing's wrong with my knee, like everybody keeps saying, then why is it that I'm not able to do anything? That's been the question. So Carrie sent me over to Hilton Head Hospital because she said, let's try to do that ink thing. Remember, I was supposed to do that the last time I was here.
Right.
So I took the paperwork and I went immediately over to Hilton Head Hospital that day, as a matter of fact, and then took them all the copies of the MRI that I had, gave them the information from Hawaii, from what the disc that they have from the MRI and X-rays, told them everything. They took me in the room because they were like, we're going to have to get to the bottom of this, because I was in excruciating pain, if you remember, when I came in, and nobody would do anything, and except Carrie when she sent me over there. So they sat me down, and they took everything, and it was Friday, and they said the radiologist had gone. They will call me Monday, because they couldn't do couldn't do it. They were going to schedule it, but they wanted the radiologist to look at the MRI and see if that would be the right test, because there were 2 tests she had put down apparently. So went there, and they called me on Monday, and they said no, that is not. If it's going to show nothing more, because it was the ink, apparently the needle with ink or something. That's not going to show anything more than the MRI. That's not the test you need. It's something else. They said that to me. They said something else. You need to go back to Dr. Rowe's office, to Carrie. It's something else, because I kept saying, what's this pain coming up here? What's this? Why am I having these issues? And so I came in here in the office on Tuesday to let them know what the doctor said. I was in excruciating pain. I could barely stand up. These 2 girls up at the front, first of all, told me that I couldn't see anybody until my appointment, which is now today. This is what they told me up front. I said, are you serious right now? Carrie's the one that said this. They told me, they sent me back here and said, we need this. I am in pain. I'm ready to go to the emergency room, but I don't know what they can do. We've been trying to do this for a year. We need to find out what's wrong with me. This is not normal. I've been saying this for a long time, and I'm to the point where I'm about to lose my mind, because I was in so much pain. Living life so mechanically, not sleeping right, nothing, because I was in pain 24/7. And the medicine that I had from Dr. Rowe, TC4, I wasn't doing shit. So I can tell you it wasn't doing nothing. These 2 girls over here, I'm so pissed right now at those 2 girls. We can't do this. You can't, we can't. I said, no, can somebody call me? So the girl in the back, she said, well, we can try to find out. I said, this has been going on back and forth for a year. Dr. Scott's office, we've tried to get me to a spine doctor. We've tried all these things, and I keep getting roadblocks, and I feel like nobody's paying attention. I'm starting to feel like a fucking number that somebody's just shuffling me around, and I'm not getting better. And this is ridiculous. I said, where I was and where I am now, and especially when Dr. Scott was the one who did my surgery, you're saying nothing's wrong with my knee, but yet I'm going in your office and my knee is blown up to here. I come in here, Carrie could see it. She saw that it was blown up. She was like, damn, we're trying to figure out what's wrong. These pains, what is this? My daughter sat up here and kept saying, Ma, her coworker came back from when she was out from maternity leave and had sciatica. And she kept saying, Mom, I wonder if maybe, and I said, I don't know. She said, maybe it's your spine though. It might not be that, but maybe your spine. And I said, but that's what they've been saying, but nobody wanted to get me to a doctor. No doctor's office. Every time I'd say, can somebody please do this? Or nobody would do it. These two girls too, especially. So.
Oh, they don't give
they don't give a rat's ass. Because, like I said, I was screaming. I was in pain in the office. I was dying in pain in the front of the room, in a doctor's office, and nobody would pay attention. My daughter was smart enough to say, Ma, this place right here, this urgent care, let's go in. We went into the urgent care. I was given an x-ray. Immediately, 14 x-rays were taken. The doctor listened to everything I said. And she said, why didn't anybody send you? Nobody sent you for x-rays? And no. I said, nobody. No. I've been saying, because I told her, I've been saying this to everybody. It's, what is this? From day one, from when I fell, I've been saying, so why is this pain that keeps coming up here? And why is this? And why is it? And it just got to the point where it floored me to where I could no longer walk. I would be walking and I would have to stop literally in my tracks. And everybody kept focusing on the knee because I fell on my knee. But hello, when your knee is connected to, and I said this the last time I was here, your knee's connected to your thighs, connected to your hip, connected to your back. Hello, now I have a busted spine. 14 x-rays later and an MRI later, I have a busted spine from last year, and nobody wanted to listen. Those two bitches up there, I'm pissed. Nobody wanted to listen. Yeah. So no, I was in pain and crying and doing everything for a valid reason, and nobody wanted to listen. Those two up there, no.
Look,
I'm so irritated.
Too loud.
Sorry.
Sorry.
So here we go. This is where I'm at now. A busted lumbar, 4 and 5.
We have all that. You can talk about
Yeah, I know.
all
They
that
just
with
sent
me.
it. Yeah, they just said. But I was just telling.
Don't take everything out.
Oh no, I'm not taking it out.
Very loud.
No. Oh, sorry. I just have a loud voice. Sorry. So that's where we're at because they didn't want to, like. Had I not found out, I was to the point where I was in so much pain, I almost passed out. Like it got that bad. Like I was crying when I was in here. I was like, what can I do? What can you guys do? They wouldn't do anything. Oh, well, you just have to wait for your appointment. I'm like, but Carrie knows. She tried to help. She's trying to find the root of the problem. Mm-hmm. She needs to know what's going on. They wouldn't let me. They wouldn't even let me tell her. Like she was trying to find the root of the problem. They would not. And the one girl, well, we'll get a message. Nothing. And then she called me. I have it written down. She called me a week later. The girl in the front. Mm-hmm. To say something about some office. I said, wow, so you waited a week. A week. And I could have been in the emergency, which I was. I was in the urgent care. Yeah. Yeah. And that, and so it makes no sense.
Yeah.
It makes. Oh, yeah, because I had to go there. And they had to, I was there this morning because they had to send it over here because I had to have them send it over here because I see Dr. Mitchell again for a spinal thing in a couple weeks, so. Yeah. But I appreciate you at least because I remember you were concerned and you were really trying to help me and I appreciate that a lot, but you cannot tell a patient you can't be seen, you can't get help. You know what I mean? That's wrong. That's on every level. That's because I kept telling them, you know. So. Thank you.
Okay.
Ooh, wheeze, ouch.
Alright, so what is it that you want us to do for you? Not focus on the knee and go to the back?
Well, see, here's the thing. Like I was saying, when I came, I told them you were doing everything to help me. Like, you have been the only one that was trying to find the root of the problem.
Well, I wasn't looking at anything in your back.
No, but here's the thing.
Exactly.
But that's the whole thing. That's what I was telling her. I said, last time I was here, you did everything. Like, I can't thank you and her enough. She cared enough she was trying to help emotionally and everything with what she could at the time. Right. Because remember I told you the other girl, you were doing everything doctorally possible. Like, I really.
But they refused the study.
I thank you. That's what I said. And so, like, I have a loud voice. So that's why I appreciate what you were doing. You were trying everything because you saw my knee. It was swollen like this. And so everybody was focused on my knee. So when I went over there, I did what you said. I went over there the next day, took them everything. They asked for everything. In fact, I was on the phone with this lady. She was like, no, we're going to get to the root of your problem. She said, this is ridiculous. They're passing you all around. This is ridiculous. I went over there. she said, just bring me what you have. I took everything. They had the radiologist. He said, we'll look at it. This was a Friday. The radiologist looked at it on Monday and called me and said, no, go back to come back to Carrie and tell her, no, this test won't do anything. It's going to show the same thing. It's not going to do any more. You're looking in the wrong place. That's what he said. He said, you tell her you're looking in the wrong place. You're talking about pains going up your leg. Go up your back. Go up your leg. It's not your knee. And they need to. So I came here the next day, Tuesday. I'm sorry. By that time, I was doubled over in pain. I could barely walk. I came right in the office, and I was trying to tell them what they said to tell you. And these two girls up front would not listen to me. And as usual, they threw me to the side. They told me, you can't see her until your appointment date. And I said, I don't care about my appointment right now. They said, we can't give you medicine. I said, I'm not worried about medicine right now. I'm worried about what's wrong with me. And I need to know what's wrong with me.
Well, did Dr. Gavin send you to a neurosurgeon for this?
I went over to the urgent place.
Okay.
They did a bunch of x-rays, like 14 x-rays. And they found, I had to wait for the MRI, but you could see in the x-ray, she showed me the shift. It's because when I fell, my bones shifted like this. Like everything goes in line with everything.
Okay.
So they did the MRI.
question is, with the MRI, what we see on the MRI, did they send you to a neurosurgeon?
Well, Dr. Mitchell is who I saw a couple days after the MRI.
Okay.
He did a spine, he put the medicine in the spine to help the inflammation.
Okay, so you've already got that treatment.
Yeah,
okay.
But that's the first treatment because he said I'm going to need at least
is he
3 to 5.
neurosurgery or do you know? What's his last name?
Mitchell.
Mitchell. Okay.
Here I have
Paul Mitchell.
Paul Mitchell. Yeah, his hair.
Like, that's a hairstyle.
Yeah.
Right. Well, okay.
And he's really awesome. And I will tell you this, like, okay, 6 months.
Sounds like he did an epidural.
Yes.
Okay.
Now, 6 months after the incident happened, I remember I was like in pain, and I kept saying, "Why am I not able to do things?" Because they said at physical therapy I should be able to do everything. Remember, I was telling you, I'm like, I'm still not able to do anything. This is crazy. Well, he had. I remember when he gave me that shot the other day when we started the series. It put me about to there. I feel like I'm back at 6 months. Like I'm.
Right.
It hurts. I'm really sore. And it's nothing sore. It's like I told the physical therapist, I don't like to put my fibromyalgia in this stuff. I had that under control.
Right.
I had that under control. And exercise and diet and everything helps to keep me under control. I haven't been able to exercise. I've gone to physical therapy. It's really messed me up. But right now, I'm back in physical therapy. I have to get back on track. I've just never felt so low in my life. I'm telling you now, I've never felt this low in my life.
Well, these usually do take a series of 3 injections.
Yes,
So
3 to 5, he said. And hopefully they'll work so that I don't have to have surgery. That's the hope.
that's the goal.
That's the goal. And hopefully with the physical therapy, like Dr. Hubbard said, it'll be able to hopefully help to shift the bone back. Because, they can do miraculous things with medicine, and I'm hoping that they work for me. I really do. Because I'm thankful that they found out what's wrong now. I'm really hurt that it took this long. I mean, I'm really emotionally upset because...
Still don't think that's the answer to why your knee is swelling. But
he said that now I will say that one of the things that every one of them said, Dr. Hubbard, Dr. Mitchell, every one of them did say that that very well could have been because, and then my compensating too.
Right.
It very well, because this was already an injured area.
Right.
And it was already messed up. And then I fell on it on top of it. And they said everything coming from this area, because now that I've had that shot and it's kind of getting me where, I can at least feel a new norm, so to speak. I hate that I have to say that, but like, I can feel different. Like when I went to physical therapy the other day, I'm sorry, I know I'm all over the place, but when I was at physical therapy the other day, I did some things and I felt good because I got the shot and the pain wasn't as bad, because my level went from under 10 to like 110. But I actually was like, oh my God, I feel like people do for the first time when they come to the gym, never worked out before.
Right.
And I was very sore the next day. And that's why I'm saying to you now, I feel like I'm lower than I've ever been in my life because I've never felt like a first-time person working out. I've always been the trainer. I've always been the one teaching. Always been the one.
Well, what we'll do is just keep your meds going. Let them treat this. we'll keep updated back and forth and see how it goes. If
Yeah.
it doesn't work, they'll send you to neurosurgery for a consult, or if they do it there, whatever.
Yeah, that's what they're gonna. I mean, now Dr. Mitchell, he's only there like every so often.
Okay.
So the medicine, the last time they gave me medicine, I have the bottle. That's the TC4. That's not helping me right now. I can't
Do
go
you
with
want?
that.
Does he do medication too? Then.
But I
He's
can't
not
get a
there
hold
right
of him because he's not there until June 30th, my next appointment. So I don't have anything. I'm down to nothing now.
Okay.
And I'll
Because
show you.
we usually do all of this too, and we can't do just meds and let someone else do injections. They got to do both, or they'll be like,
Yeah, I don't
God,
see
please be
him.
careful.
Oh, I'm sorry. I don't see him, and I can't. I tried getting a hold of them. I called them yesterday, and nobody got back with me. So I don't know
Okay.
how. That's when my next injection is. And
oh, he's the same thing we are. He's pain management, so you just need to transfer everything to him.
so, but until then, I don't have anything.
Well, I can refill. I can't
Yeah.
change you, but I can refill. I know it's not getting you through, but I can give you the 30 days until you can see him again. But basically,
Okay.
you would just transfer all care to him because he does the same thing we do.
Oh. But that's only for. But I'm only seeing him for.
He does everything. He's pain management. He's the same thing we are.
Oh, I had no idea. So, what does he just focus on spinal or?
Well, I mean, if someone sent me this MRI, we would have done the same thing. But your thing was your knee. I know you had pain in other places, but my thought was that you're trying to get this lawsuit taken care of with your knee.
Because we all thought, everybody thought.
Right.
That, I mean,
So I
that's
wasn't even
my
treating any of your other problems. I was just trying to. If you came and said
the knee.
you have a torn ligament and all of a sudden it's not torn, I that doesn't make sense to me. But yeah, you'll transfer all care to him.
But but if you guys do the same
Oh,
thing, and I've already been here.
It's not good to stay here. I think at this point is the best for a change.
Oh, because of the.
It's too much.
Really?
It's too much.
Because of the lumbar.
No, because the front desk, the not being happy, we can't have all of our patients hearing all this. No one else comes in here and acts like this. I hated that it's had to happen to you, but it doesn't look good for our business. So when you come in and you cause a scene like that with this many people in the office, it's not good. And I understand that. You're very upset, but he does the same thing we do. Y'all got a better start, better staff. We'll transfer everything to him. Okay? So you'll drop this off front. I'll bring your meds. You'll need to sign a release with him so we can get all of our notes to him. When you're there next, he'll fax us over a release. That way there won't be a charge for any of the notes. We'll fax everything to him. Okay? And then I'll bring up that last script of the Tylenol codeine, but he'll take over everything for you.
Now, where is his office?
It looks like in Moss Creek.
Well, I mean, that's where we saw him at that urgent care, but I don't think that's where his regular office is.
PaulMitchellPainManagement.com.
Because it's Dr. Gavin's whole.
A lot of times they bring in pain management a few times a week.
Yeah, because, I mean, they have physical therapy, they have.
So he's not an anesthesiologist like Dr. Rowe. He's just pain management, and that's fine. He'll do all that for you. Yeah. So it looks like that's where his office is. That's the only address they give.
I mean, there's a bunch of doctors there.
Yeah. So he's probably just part of a group. Yeah. But yeah, he treats everything. So that is where his office is. He's probably just there certain days a week. He may travel to somewhere else. They can tell you that though. But when you'll have enough medication to get in with him and just let him know that visit, that we'll just transfer all care to him.
Okay.
Okay?
So I should get copies. I need copies of all the records and to send to the lawyer's office.
From here?
Yeah.
Yeah, so if your attorney requests them, it's not going to be the same charge for, like if a patient requests them, they charge per page.
Mm-hmm.
Attorneys can get them cheaper.
Okay.
And the doctor can actually get them for free. We send everything to a physician for free. So when you're at his office, you'll sign a release. They'll fax it to us. We'll fax everything over for no charge.
Okay.
Okay? All right, and I'll bring your prescription later.
Thanks.
All right, good luck with everything. I hope they get you feeling better.